Welcome to the High Value Sales Show of Eversprint.com. I'm Malcolm Louie, the managing member of Eversprint, and today we're speaking with Rick Lunsford, the owner and CEO of Blossom Ridge Home Health and Hospice, a hospice and in-home skilled medical service provider to patients throughout the greater Sacramento and San Joaquin counties. Welcome to the show, Rick.
Thanks, Malcolm, for having me. Appreciate it.
Rick, you grew your company's revenue from $3.7 million in 2014 to $12.4 million in 2017, a 239% increase. And in 2018, you hit around $16.5 million. Before we talk about how you grew your company so fast, can you briefly share what your company does beyond my quick intro and how your company differs from the competition?
Absolutely. We are a home health and hospice agency here in Sacramento. We have 4 offices now, one in our headquarters location here in Sacramento. We also have one in Yuba City, one in Stockton, and another office that we recently purchased there in the San Francisco area. So we provide skilled nursing and therapy rehab services to the older population. Most of our patients are Medicare age or older. And half of our business is in the hospice arena, where we provide those type of services to older folks that are in the last 6 months of their life. Yes, we've had a good run. Absolutely. We continue to grow year over year. It wasn't our intention to be on these lists of fastest growing companies. It just kind of happened that way. But we've been learning a lot. We started about 7 years ago, and we've been growing ever since pretty rapidly. And we really concentrate on the patient, and that's what it's all about here at Blossom Ridge. Is we want to treat our patients like you want your mom or your grandma treated, and that's what we tell all of our clinicians, and they have the freedom to do so. We don't look at the cost that it takes on any one patient. We want to always do what's right for the patient. And we're finding that as we do that over the years, we're gaining a good reputation from the patients. They're telling their doctors and the referral agencies, and we're continuing to get more and more referrals that way. And that's really what we concentrate on, is the outcomes of our patients and our patient satisfaction numbers. And we do everything in our power to keep our patients from going back to the hospital. And that's our duty. Right.
Yeah, I think what you shared now might have answered my next question, or part of my next question, in regards to the 3 biggest drivers of your sales growth from 2014 to 2018. You mentioned your focus on the outcome of the patient as well as the patient satisfaction. Would you say those are your number 1, number 2 drivers?
Well, they're absolutely the most important factors. I mean, if you look at the aging population of baby boomers, the macroeconomics of it is one of the big drivers. There's just a lot of patients that are needing these type of services. You probably heard the number, some 10,000 patients a day turn 65 and get on Medicare. Those baby boomers are just starting to hit, and they're just starting to need services like what we provide. So from a macroeconomic standpoint, we're in a good place. But yes, it's still very competitive. All the hospital systems, et cetera, have their own home health and hospice lines. So we need to become those preferred providers that the hospitals are really looking for. And what we hear constantly is, how are you at keeping our patients from readmitting? And we pride ourselves on that, on the outcomes of our patients, keeping them from going back to the hospital. In fact, our numbers are well below the national and regional averages for rehospitalization rates on our home health side. And that's what we tell our partners. We can keep them from going back to the hospital better than most. And we prove that over and over. So if we concentrate on the outcomes of our patients, and then, of course, the patient satisfaction numbers, which we're a 4-star rated agency currently, we find that we continue to get the referrals, even from the hospitals and even in a very competitive marketplace.
Right. Now, when you mentioned you focus on the outcome of the patients and keeping them from going back to the hospitals, how do you go about doing that? One way, of course, is being very selective, right? And making sure that you only accept patients that your team can help. Is that one avenue that you?
No, that's not really. No, we can't pick and choose our patients. If a hospital is giving you a referral and you say no because it's too tough, you're not going to get many referrals from that hospital. So, in an ideal world, would you like to do that? Perhaps, but in a realistic world, no. We just basically accept the patients that are given to us, and we do the very best we can with each of those patients. So, some of the patients are out of scope for what we do, but that's a different that's a very small number. But yeah, when those hospitals or skilled nursing facilities are referring to us, they really want us to take whatever they're giving us. And we do for the most part. So we put a lot of programs in place, just what we call our high risk rehospitalization program. And when we do get one of those high risk patients, we put a lot of time, a lot of resources, and a lot of money behind us and behind that patient in order to keep them out of the hospital. So basically what that comes down and looks like is we'll do extra visits, we'll add on a home health aide where sometimes other agencies will not. We'll do a lot of therapy visits. We'll do basically whatever it takes to keep that patient from readmitting. We have started some other new programs, like a telehealth program for some of the high risk patients too. And we're just getting going on that, so we don't really have any outcomes to provide at this time, but it's looking very positive for keeping those patients out of the hospital.
All right, fantastic. In regard to your patient satisfaction numbers, what metrics are they exactly?
Well, Medicare sends out a survey to all Medicare patients after they've experienced any home health service. And we have no control over that. It's sent, and some patients will answer the survey and some will not. On average, about 30% of patients do nationwide answer the Medicare surveys. And then based on the answers to the Medicare survey is what we get as a star rating. And the best star rating you can get is 5 stars. And we are currently at a 4-star rating for our patient satisfaction. And there's, I think, some 40 or 50 questions that are asked by Medicare in that survey. And it all ends up getting published on Medicare.gov. Each quarter it's updated. So our goal has always been to be a 4-star or higher agency. And that's where we currently are. And we've been that for quite a while now.
So why not shoot for 5-star instead of 4?
Well, yes. Our goal is 4. We feel like we can be at 5-star, but because of the challenge of Medicare and the survey system, I'm not gonna sit there and tell my guys we got to get 5-star when it's pretty hard just to get 4. So I feel comfortable with setting the goal at 4 and shooting for 5. I don't want to have a goal of 5 and not attain it, and then my people won't feel quite as good about what they do.
Right.
So exactly. That's why I want to have 4-star.
Right. From the survey results that are given to you, what areas would your team need to improve upon to bump up the rating higher?
I don't have it in front of me. There's, like I said, there's a number of questions on that. I'd have to give you a better answer. I'd have to look at it, and I don't have it in front of me. Sorry.
Sure, no worries on that. And the third driver that you talked about, the macro factor of really being in front of this wave of a huge number of people who are going to be needing these services.
Absolutely.
Is this something that you foresaw 5-6 years ago, and then you say, "Oh, let's start a business and get in front of this"?
Well, that's the basic reason we started the company. Frankly, there was 2 other partners and I that started. We were actually, one of us met in our MBA program, and his wife was a nurse and had mentioned home health services, and then so we just started to research it. And as soon as I started to research this industry, I just thought, my gosh, with the baby boomers coming, this is going to be around for many, many years. And so at that point, I was actually let go. I was in a pharmaceutical job at the time. It's about, I guess, 8-9 years ago. And it was perfect timing. So as soon as I got laid off, we put a little bit of money together to start this company, and we just ran with it from there. But yes, I mean, I thought these type of services are going to be needed for many, many years. The baby boomers were going to start hitting, and they've only just started to really hit the system, and it's only going to continue to increase from here.
Right. Now, when you started a business, to what degree did you and your two partners have experience in providing in-home healthcare?
Oh, zero. Absolutely no experience at all. So we started from scratch, knowing basically nothing about home health or hospice services, frankly.
Okay.
And so we had to learn, from the ground up, from getting our state license to our Medicare approval. It took almost 2 years for that to happen. And another maybe year or two after that before we even started to see any revenue. So it was a big learning curve for us. The good part about that was we did have to start from scratch. We didn't buy a company and take over an existing operation. So we know how to build a company from the ground up in this space, which we didn't know how to do. So we had to learn every aspect. And now we've hired for years now, we've had a number of people that have been in this space for a long time. And quite frankly, they do the operations on a day-to-day basis now. But yeah, it was, I'm not sure I would recommend that route to most, but it's worked out for us. And yeah, we're pretty proud of that.
Right. So how do you go about getting your first customer, your first patient?
Well, this was 7 years ago, I guess. 2013 was when we got our first patients. And I had mentioned to you that I was in pharmaceutical sales a long time ago. I was a sales rep and I was a sales manager for a large company here in the Sacramento area. As a result of that, I got to know quite a few physicians in the area. And so I went back to many of those physicians that I knew and just asked for referrals for home health at the time. And they would give us one or two here, one or two there, nothing major, but just enough to get us going and to learn how to do it and to meet the requirements that Medicare had. And so it started off with the local physicians, the primary care physicians, mostly in the Sacramento area. And it grew from there.
All right. Awesome. Now, in terms of getting new business today, what's your marketing plan? How do you go about doing that? I know referrals are a big part of it.
Well, this pretty much everything here is referral based. All home health, all hospice is all referral based, has to come from a hospital or a physician of some sort. So we've grown our sales force. We have a sales director. We have 9 sales reps. And all of our reps just call on their accounts, the hospital accounts, the skilled nursing accounts, the physician accounts, all of those. And because we have such a good star rating, we have such a good readmit rate, we have a lot that we can sell. Our service, we have a lot of proof. And as the years go on, our reputation improves, and we were able to get in some bigger accounts like the hospitals. The hospitals is where most of the volume comes from, and it also took us the longest to get into those hospital systems. But now we get over 60% of our referrals from our hospital partners. And so we have an aggressive sales force, but mostly it's based on our high service levels, our high star ratings, that we can really sell our service.
Right. How long does it take to get a new hospital? And I imagine when you say hospital, you're not referring to just one physical hospital. You're referring to a whole network of hospitals, right?
Yes and no. It doesn't quite work that easily. Okay. You have to kind of get one at a time and prove yourself. And so, yeah, we have, the hospitals here in the Sacramento area, San Joaquin area, that refer to us now. But it took us probably 4 or 5 years before we started getting any kind of referrals from them. And over the years, it slowly increased. I think as their confidence in us as a service provider increased as well. It took a long time. We started off with physicians, and then we went on to skilled nursing and assisted living facilities. And then finally, we were able to penetrate some of the hospitals and hospital systems. But there's no contracts, there's no promises. Each week goes by, and they could send us 0, or they can send us 20 referrals. You just, honestly, you don't know, which is one of the challenges of operating, a company like mine.
Right. Now, I assume do they have like a formal list of approved providers of in-home healthcare, or is not even that?
Well, that's a kind of a funny question, Malcolm, because they're supposed to offer their patients, all the hospitals are supposed to offer their patients a choice of which providers, home health providers they want to use, and they always have their own, right? So they always prefer to use their own internal home health and hospice system, but mostly they're full, quite frankly, and that's where we come in as a backup to their own provider, and we just want to be a backup when they are full. So they do offer the patients choice, and they'll give them a list, and I don't know who's on the list or not, frankly. It's kind of a mystery list, I guess, but then we get referrals out of it. So I guess we're on the list. Right.
Now, are you working with, say, one of the big providers out there like Kaiser? Are they on your list right now, or are you on their list?
We have a contract with Kaiser. Yeah, that's a separate. That was a separate kind of deal. We have to. They're the one provider out here who they have most of the market share, of course, but they require you to be contracted with them. But just because you're contracted doesn't mean they're going to give you anything. Then you are on their list as a contracted provider.
Right.
So yes, over the years, we've got a contract with them for home health, for hospice services. And others like Sutter, Dignity System. We are not contracted with them, but we are a preferred provider of theirs.
Okay. So when someone at Sutter and Dignity needs, their own in-house services are booked up, they need to refer someone else.
Yes.
How do they go about choosing you as opposed to the other people that they know about? What do you do to stay top of mind with them?
Well, this is where we have our salespeople going in there, reminding them of our service, our star ratings, our rehospitalization rate, etc. So we are competitively selling against other providers like me for them to choose. So we stay aggressive with the direct marketing staff. And that's basically how we do it.
Right. So they're constantly selling, essentially.
Oh, yeah. Yeah. My people are out there right now.
Right.
I mean, just because there's a lot of patients doesn't mean they're going to come our way yet.
Right.
So we have to be competitive, but we have to have a good service.
Right.
And that's what we concentrate on. There's a fair amount of competition, but most are not 4 stars. Most do not have the rehospitalization rate that we have. So, we focus on what our partners are telling us they need from a partner. And we put that into play every day.
Right. Now, when you're marketing Blossom Ridge to the hospitals and your sales team is doing that, is it all done in person, over the telephone, or do you have a advertising campaign running as well?
No, it's all in person. We don't really advertise. The challenge with advertising in our space is most people have never heard of home health. They have heard of hospice. So some hospice companies do advertise that way. Our biggest challenge, honestly, is not getting referrals most of the time. It's getting qualified staff, nurses, and therapists that want to do things the right way, in the Blossom Ridge way. So we've done some advertisement like that, and because it's a referral-based business, they have to go back to their physician, and the physician actually has to send us a referral. So it's a bit cumbersome to just advertise and say, hey, come to Blossom Ridge, when it's not quite that simple.
Right.
So we've shied away from direct advertising in the marketplace because of that.
Okay.
And concentrate on our partners mostly.
What about marketing to your contacts at the hospitals?
Mm-hmm.
Right. Do you do any form of targeted marketing to those folks?
No, we have not. No, we've looked at some more, more pinpoint type advertising, but we haven't followed through on any of that.
Mm-hmm.
It just hasn't been a huge need thus far. And as a result, we just haven't done it.
Right. Meaning there's not a big need because you're getting plenty of referrals right now.
Right. We there's weeks where we have too many referrals, which is one of the things that I don't look forward to, is when we can't accept a referral.
Yeah. What happens then?
Well, we have to tell them no, we're full, because our obligation through Medicare is we have to start a patient in 48 hours from the moment we get the referral. We have to be out there in 48 hours. And we want to be out there in 48 hours. We try to be out there in 24 hours. The faster we can get out to see the patient and get care for them, the better outcomes we're going to have, and the better patient satisfaction that the patient's going to have. So there's a lot of benefits to get out there fast and start care immediately. So we don't want to push out patients. There's some agencies that do, but not only is that, I think, unethical, it's actually against Medicare protocols. So once we get to that point, we try to hire and we try to staff properly, and it does not happen very often where we have to say no to a referral, but it certainly does happen from time to time.
Right. And when you say no, then they just refer to someone else, or can you take your overflow and
typically
to one of your partners?
No, they'll just refer out.
Right. Okay.
So, they're going through a basic algorithm too. They start with their own agency. They say no because they're full, and they're almost always full, frankly. Then they go to outside agencies, and then they go, in their preference. And then if we say no, they'll go next one on the list. So that's another reason we don't want to say no, of course. Right.
Got it. And you mentioned before how hospitals, they really prefer that patients don't come back, right? And on one hand, of course, you don't want the patients to come see you if they don't have to. But then I'm thinking, on the other hand, that's a revenue opportunity, right? If you look at it from a purely numbers perspective.
Right. Right.
So,
well, that's the dilemma of running a hospital. They're under very tight guidelines from Medicare as well, and if their readmit rate is too high, they get penalized monetarily. So, you'd have to talk to a CEO of a big hospital to know exactly how they work that. All we know is they are under a lot of pressure not to readmit a patient within 30 days.
Right.
So whether that brings more money to their hospital or not, after they get penalized, I don't know all those details, but
right.
It is a interesting dilemma that a hospital CEO would face.
And also it's similar to you, right? When you talk about patient satisfaction, I imagine if no patient wants to go back to the hospital, and if the hospital provides a home health care options that allow them to not go back, right, they're happier, and they'll refer more people to the hospital as well as to your service. So,
no, absolutely, you're right. Nobody wants to go to the hospital, frankly.
Yeah,
I mean, it's just not a fun place to be, and that's why home care is so important. The cost of home care is pennies compared to the hospital stay, and we have very, very good outcomes. Our patients get better at home. They're happier at home. So if we can provide nursing and therapy and aids to them at their home, that's a win-win for all. And that's why Medicare pushes home health and hospice services so much over hospital-based services. The costs are pennies compared to the hospital costs.
Right. So I actually did a little bit of research into providers of those services, the hospice providers, not necessarily in home, but where you take them to their facilities. And the ratings generally aren't very good. It seems like looking at the consumer-based review sites, right, like the Yelps of the world. Is that just a nature of the industry?
You're saying that they're happier at home?
No, that the service levels of the healthcare providers outside of the hospital, consumers generally don't rate them very well. Notwithstanding what your ratings might be, if I'm saying just broadly, we're just doing a quick Google on hospice providers or skilled nursing providers.
I don't necessarily agree. I mean, if you look at a skilled nursing facility, that's completely different. That's in a facility. Hospital in a facility. We're the only, home health and hospice are really the only ones that take care of people at their home. I don't know what exactly you're looking at, but I can just tell you the numbers that I see from like patient satisfaction. I mean, we have some over 90% of our patients, highly recommend us, things like that. So I'm not sure, what you're looking at exactly, but
it wasn't in-home services per se. It was more of the outside of the hospital, but they were at a facility with skilled nursing, right? I was checking that out.
Well, nobody wants to go to a skilled nursing facility. If you've been in one, you don't want to be in those. So we get a lot of referrals from skilled nursing because patients will go from hospital sometimes to a skilled nursing facility for rehab. And then skilled nursing facilities also are mandated to get patients in and out as quickly as possible by Medicare and other payers. And so then, you're going from hospital to skilled nursing, then finally to home health services at your home. That happens quite a bit. So I'm not sure that skilled nursing or hospital-based systems, I'm not sure what the satisfaction levels are there.
Right. Got it. So before we talk about the macro wave, right, you have this huge wave of people who are getting older. That's going to be a huge one, right? It's like a tsunami that you're riding. Are there other trends you're seeing that you can capitalize on and positively, or perhaps ones that you need to position the company to avoid?
Well, there's certainly some ones that we need to avoid. We work for the government, basically, Medicare. And Medicare is always on the chopping block. Every year, budget-wise, we're seeing reductions. We have some serious headwinds in that area. That's also a macroeconomic force that's coming. And every year it's coming, but this year they're actually doing some significant changes. The most significant in home health in, I think, 15 years is called the PDGM. And they're changing the entire way that we are reimbursed from Medicare. There's no way to avoid this. There's only ways to get ready for it, frankly. And it could be very, very serious. And they anticipate, in fact, 30% of home health agencies may even go out of business because of this change.
Wow.
So we're working diligently on that now to get ready for this change coming in January of next year.
Now, why would 30% of the home health care companies out there go out of business from this change? What's happening?
Well,
exactly?
Many of the home health agencies are pretty small, relatively speaking. There's a few monster players, billion-dollar companies in this space, but really it's very fragmented, and there's a lot of mom and pops, like under 5 million in revenues, like we used to be not too long ago. And cash flow is king in this business, like all businesses. And the changes that are going to take effect are really going to negatively impact our cash flows the first quarter of 2020. And I just don't think that some of the small players are going to have the cash infrastructure and ability to get the cash that they're going to need to ride through the first quarter. And I think that's where they're coming down with this 30% rate. Who knows exactly how it's going to pan out, but I don't doubt that number, actually. because of the cash flow problems, and in general, they're expecting about 8% reduction in our rates. Most companies, smaller ones especially, home health on the home health side, would be lucky to have 8% margins. So there's going to be some significant challenges to the small and even medium-sized players.
Right. So you mentioned before the cash flow is going to be tough in the first quarter. Does that
Yeah.
they're also deferring payments as well?
They are, yes. The way Medicare works now is we get 60% of our payment per patient basically upfront. Within 2 weeks of a patient starting, we usually receive 60% of that. They're reducing that down to, I think, 25%. And then 2021, they're supposed to be getting rid of that upfront payment, where they would pay us all at the end instead of half of it basically at the beginning, which the half at the beginning really helps us with, operating the company. So if you don't have either enough cash saved or line of credit or some other way, I'm not sure how some of these small companies are going to be able to operate.
Right. It's going to be tough, especially that first quarter, right? Before they get paid.
Yeah, exactly. It'll catch up, but you still are going to have to operate with a lot less money the first 2 months, 3 months. And, you're going to have to be really, really good and really smart, I think, as a small business operator to be able to make it.
Yeah, definitely. Now, before you mentioned one of your bigger challenges is finding qualified staff. So what are your plans for that?
Yes. Well, we get most of our staff now from internal referrals, which is nice. And that's where, we do a lot of marketing online. We do a lot of events. We're always, frankly, looking for good nurses and good therapists. So I don't know that it's going to get any easier over time. Fortunately, we're also well known here in the Sacramento area. So our problems here in Sacramento are a little bit easier to overcome just because of our reputation. Now, some of our outlying areas like Yuba City and Stockton are a little bit tougher just because of the size of the market there is a little bit smaller. But we were voted, one thing that helps us with recruiting is we were voted one of the best places to work in Sacramento. We got it this year, and we had it 2017, I think, or 16. So we have a good reputation. We take care of our people extremely well. Great benefits, good pay, very flexible, collaborative environment. So that's the one thing that we have that most other agencies don't have, is our culture is really good, and we get a lot of referrals from our own people, which helps us tremendously.
Right. So what's the plan for the outlying areas where your reputation isn't as well known? You mentioned Yuba City, for example.
Yeah, it's tough. It's a slow and steady. We're just fighting in those areas for good clinicians, and that's all we can do. I mean, we do a lot of recruiting, a lot of word of mouth, Chamber of Commerce stuff, small things like that, and we're doing good, but we could always be doing better in the recruiting side. So yeah, it's an ongoing struggle. It's probably our top 1 or 2 challenge that we face ongoing.
Right. What's the other challenge?
Well, what I talked about with the referrals, they're not guaranteed. So some weeks it's good, some weeks it's too much.
Okay.
And to be able to balance that properly and still make profit as a company is probably our biggest challenge. It's an operational, it's a big operational challenge. To balance it properly and yet give people a full-time salary and work environment when the referrals are not always there.
Yep.
Sometimes they're there too much, sometimes they're not there enough, and there's no guarantees in that area. So we're constantly trying to balance that.
Yep, I can see how tough that is. Back in my business school days, we did a very simple game where each of us were lined up as a part of the supply chain, and we were getting steady orders all the way through and all the way through,
Right.
and all it takes is one person to just have to make one change, and then it just
Right.
ripples
Right.
through the whole system, becomes a complete nightmare at the end.
Yeah. Yeah. No, when we're full and we have, we have plenty of referrals, things, I'm not saying they're easy, but they're more predictable. And if they're more predictable, it's easier to run a business. When it's not predictable, that's when you get paid the big bucks for trying to figure out how to do it and still make a profit.
Yeah, yeah, right. I mean, you don't want to overinvest and have
Right.
people sitting around, and nor do you want to be underinvest and have to
Right.
not accept referrals, right? That doesn't help you in the long run. So yeah, very tough.
Exactly.
So a few final questions for you, Rick.
Sure.
What message would you show on a billboard along the freeway that's only going to be seen for 6 seconds or less? And maybe we can talk about two different billboards. One for the hospital side to get more referrals from them, and then perhaps another one from a staffing side.
Ooh, that's our tagline here is Blossom Ridge, your comfort, your care, your home, our passion. So that probably fit on nicely on a billboard of some sort.
Yep.
Yeah, I think I could go with that.
Yeah, that one actually works both ways, right? Both for the hospital side, your healthcare professional side, as well as on your recruiting side. So, got it. And who are your ideal patients? And what's the best way for them to contact your company or set things in motion to get them to go to your facility or go to yours or turn to you for a service?
Well, thanks for asking. I mean, our patients are typically Medicare age, 65 and over, although we do take younger patients that need rehab, but they're usually coming out of a hospital or a skilled nursing facility that need rehab services at home, basically nursing, therapy, aid, any of those type of patients that need help at home. Or of course are looking at hospice, and hospice is, a side business is very important and underserved, yet people don't like to talk about hospice that much because it kind of means people are passing away. But we provide care for patients that are within 6 months of passing, based on what their physician has said. And we provide spiritual help, chaplain, nursing, aids, all those to just help with quality of life at the end. So anyone that's unfortunately within 6 months of passing should really get on hospice services. I mean, it's really for the family as well to help support their mom or their dad in their last months of life. So
and these hospice services are done at home as well, or you have a facility?
Yes. No. This is all at home. That's all we do. At home services, period. So, half of our company does rehab with nursing and therapy, and the other half does these hospice services, which is done usually by spiritual counseling and nursing and aids to help shower and things like that. Mm-hmm. So really to improve quality of life in the last months of people's lives.
Right. So for these best patients that are a good fit for your service, your at-home services, how should they go about inquiring about how they engage your firm?
Yeah, there's a number of ways. It's all referral based, so it has to basically come from a physician. So you can always ask your primary care physician for these type of services. But like I said, most come from the hospital or skilled nursing, where you would talk to the discharge nurse at the time. And anyone that's been at a hospital knows the discharge nurse. They come in, talk about next steps after you leave the hospital. And they're the ones that are ordering the home health or hospice services, generally speaking. So the patient would just have to ask them for they want to use Blossom Ridge, and then they're obligated to send us a referral at that time.
Right. Even if they're not on the list, on their own internal list?
Nope. Yep. Patient has 100% choice. And we get a lot of patients these days that go and look at the outcomes and look at the star ratings, and they'll call us up and say, we want to use your services. How do we go about it? And we always have to say, go back to your physician, tell them you want to use Blossom Ridge.
Right. And Medicaid doesn't have a list of providers, right? I mean, if once they're licensed, you can go, anyone can go.
Yeah.
Right.
Yeah, Medicaid is, well, it's mostly managed Medicaid here in California now. Blue Cross or Health Net, other providers manage it for the Medi-Cal population. And so you would just have to go through your provider, if you're a Medi-Cal patient, and they would order it.
Okay. So even if the hospital doesn't refer you, it doesn't have you on their referral list. People can still say, yeah, I want to go here.
Right. Absolutely.
All right. Got it. Rick, it's been awesome having you on my show today. Really enjoyed hearing about how you grew your company so fast.
Well, thank you, Malcolm. I enjoyed the time.
We've been speaking with Rick Lunsford, the owner and CEO of Blossom Ridge Home Health and Hospice, about his company's rapid growth. For interviews with other fast-growing, high-value sales companies, or to learn how we can accelerate your firm's high-value sales through automation, visit eversprint.com.